I'd now like to introduce Pam Norley, President of Fidelity Charitable.
Hello, I'm Pam Norley. As was just mentioned, I'm head of Fidelity Charitable, and I'm pleased to welcome you to this COVID-19 update to discuss how you, as Fidelity Charitable donors and other people looking to support relief, can help. Thank you for joining us. As this pandemic has spread more rapidly, with many more cases expected in the coming days and weeks, this poses unprecedented challenges in our communities, our country, and around the globe. Needs are arising daily requiring immediate attention, ranging from urgent medical relief and protection from the spreading virus, to supporting those impacted economically with the loss of jobs, to sustaining nonprofits whose major fundraising activities oftentimes involve gatherings or volunteer access. Fidelity Charitable donors are mobilizing quickly to support the immediate and lasting relief needs that are ahead of us. Grant volumes are up. To date, our donors have given away more than $1.5 billion to nonprofits in January, with most of the grants going to support COVID-19 causes this month. We've seen a remarkable outpouring of interest from many of you looking for guidance on how to give more effectively to help address the issues facing us. We have close to 3,000 people who have registered for this webinar. The Fidelity Charitable team is committed to providing you with information on how your charitable dollars can most effectively be deployed during these times to provide the greatest impact, with this webinar being an example of that. We believe that this will be first of several to help you understand the many opportunities to provide financial support to those in need. We've organized our guidance into 3 areas. First, supporting medical needs and protecting the safety of our communities. 2, protecting vulnerable populations impacted by COVID-19, and we define vulnerable very broadly. And 3, sustaining all nonprofits who are particularly challenged in these times. Today's webinar, in collaboration with the Center for Disease Control Foundation, specifically addresses supporting medical needs in our communities. New developments are arising as I speak, and this session is designed to give you the latest facts in the spread of COVID-19 and, more importantly, lay out a plan for you to act now in responding to the need for more philanthropic funding. Guidance exists on our website, fidelitycharitable.org, to help you with the other 2 priorities, but we will do more, as I mentioned, virtual conversations in the coming weeks to provide you with more information on those. The conversation today has 3 objectives that we want to provide you with information on protecting medical needs at this time. 1, we want to provide key current information on the spread of the pandemic, and we have a distinguished guest from the CDC Foundation to give more information and updates to the minute. 2, we want to talk about what's needed to support relief efforts now, and 3, we want to share with you some key resources. To help us answer some of these questions, I'm pleased to introduce someone who has dedicated her career to protecting people and saving lives, Dr. Judy Monroe, the President and CEO of the CDC Foundation. She spent 6 years at the CDC prior to joining the foundation in February of 2016. And in her work now, Judy advances priority programs that improve the health of people around the world and prepare other nations to better prevent, detect, and respond to dangerous health threats. The CDC Foundation mobilizes philanthropic and private sector resources to support CDC's critical health protection work, managing hundreds of programs here in the US and in more than 130 countries. Under Judy's leadership, the Foundation is currently supporting CDC's response to COVID-19. Thank you so much for taking the time to be with us today. We have a lot to talk about, so let's dive in. Thanks, Judy, all eyes are on the CDC as a leading source for the nation's COVID-19 response, and you have personally been on the forefront and the front lines of a philanthropic response. Can you give us a little background on the CDC Foundation and how you work in partnership with the CDC to address and tackle the pandemic?
Yeah, well, first of all, thank you, Pam, and to Fidelity Charitable for the opportunity to join today. I wish it were under other circumstances that we were together. So the CDC Foundation is an independent a nonprofit that supports the CDC, the Centers for Disease Control. But before I tell you much about the foundation, this is an unprecedented time. And just to remind everyone, it's a once-in-a-lifetime experience that we're all together in. History has taught us that pandemics occur periodically. We go back 102 years ago, and we had the most severe pandemic in recent history, and that was the 1918 influenza pandemic. This is the first time that a pandemic has been caused by a virus other than an influenza virus with the coronavirus. So the CDC Foundation, we're a bit of a unique foundation. We were established by Congress in 1992 to help support the Centers for Disease Control. We went into operations in 1995. So we're in our 25th year as an independent 501c3 nonprofit, but we're also an operating foundation. We're not endowed, so we are supported through our donors. And we've built a number of capabilities as an operating foundation to serve the needs of public health. So an example of that is we can quickly hire CDC Foundation field staff to be on the ground and to surge staffing. We did that in the opioid crisis. We actually hired local staff in 12 different states that then helped with the opioid crisis. We do serve the Centers for Disease Control across the entire agency. So we do everything from infectious to non-infectious disease, injury prevention, environmental programs, and domestic and global, as you mentioned. So over the years with emergencies, we've established an emergency response unit, and we have stood up and helped with Ebola, Zika, Hurricane Maria most recently. And just to give the folks listening in a little bit of grounding on how that works. So as an example, during Ebola, we got flexible funding. We all watched how that unfolded in West Africa, and then a few cases here in the United States. That flexible funding that came to us from the donors allowed us to build emergency operations centers in West Africa. They didn't even have a place to meet to be able to take on these epidemics. We rapidly trained field epidemiologists. We were able to build lab capacity and quickly funded the vaccine trial in Sierra Leone, which was really important because you had all these cases, we had a vaccine, we needed to test that. Funding from government wasn't available yet. We got it kickstarted and the government funding came in after that. And so that's that flexibility and catalytic nature of philanthropy. Then one of the things we were really most proud of is at the height of that epidemic, in Freetown, we got a call from CDC and they said, we have got to break the back of Ebola. We've got to stop this surge. They asked us to be able to hire community members to quickly train them to do contact tracing. We turned that around in about 2 hours by the time that the request came in. And that's now, you can read about the Western surge in Ebola. So now that takes us to COVID. And if you look at this slide, there's a photo there of the Emergency Operations Center at CDC. They activated in January. And what we did just a few days later, we then activated our emergency fund to be able to get the word out to philanthropists and private partners that this was a threat that in fact would require an all hands on deck approach. And so we've been responding to the needs as they arise. We must realize that we are fighting a war against an invisible and deadly viral enemy. Things are changing day to day. And so our approach at the foundation is to get real-time information from CDC, our partners on the ground, the local health departments primarily, and other colleagues and nonprofit organizations to be able to really respond and take care of what's needed in the moment.
That's amazing. And thank you so much for all you do. I think, we often overlook the importance of the foundation that's associated with CDC and all the kind of philanthropic support that is needed to help mobilize us quickly. So tell us, I know you and I talked on Friday, we talked earlier today, you said things are changing kind of by the minute. Can you give us the latest update?
Yeah, I had to do this morning to take a look because things are happening so much. So this slide that's up now really helps depict the relentless spread of COVID-19 that in the last week has brought more heartbreaking stories and startling news. Coming out of Italy, if we take a global look to start with, Italy last week surpassed the number of deaths from COVID-19 from China. So Italy now has, as of this morning, 5,476 deaths, and compare that to China, 3,255 when we were looking at everything in Wuhan. New York City has become one of the epicenters here in the U.S. We have several cities now that have become epicenters, and New York City is densely populated, and that's it's just overwhelming their hospital systems now with all of the cases. The doctors in Italy are pleading now with other countries to learn the lessons that they have learned the hard way, the plea is to take care of sick patients at home. They believe that hospitals might be one of the main sources for rapid spread of this, and sadly, because of the stress on their systems in Italy, they are now coming out, stories are coming out that they will no longer allow access to ventilators to anyone over age 60. So that's alarming, and this is, we've seen that in our pandemic planning scenarios in the past. I've done a lot of pandemic planning, and this is one of the worst. So as cases are increasing worldwide, as this slide shows, 341,722 confirmed as this morning. And as we're talking, those cases are clipping up. The number is going up just as we're having this conversation. 14,765 deaths. So the other thing that happened this past week is we surpassed the number of deaths during the Ebola crisis. It was only 11,500 or so. And the US currently has the highest count, the highest number of confirmed cases in the world, with over 35,000, with 458 deaths. I gave a talk on Thursday and we had 150 deaths. So just in the last week, the number of deaths is, we're on an accelerated phase of this curve, this epidemic curve or the pandemic curve. And we know that the real number is much higher than that because of, we know now that it spreads from people that are asymptomatic. And what I've told everyone is just assume if you're out, I recommend everybody stay home. We've got 100 million people in the US now in the last week asked to stay home. But you almost have to assume that folks are positive, and then that will drive your behavior, right? If you assume you're with someone, you're going to keep that physical distance. You're going to wash your hands. You're going to wipe surfaces down. And you're going to take extra caution. The other thing is we just don't have the answers yet to a lot of crucial questions about this virus. Scientists are working diligently to learn more. Research is underway. The race is on for safe and effective vaccine and for therapeutics. So what have we learned? We know that this is more infectious than SARS and more infectious than influenza, which in the beginning they weren't so sure about. We know that it's not just older people, which initially was the news coming out. We now know that young children can develop viral pneumonia, and we're seeing our 20 and 30-year-olds being sick and needing critical care. I mentioned overwhelming our healthcare systems. We've got supply chain issues that folks are trying to address, and our healthcare workers are in peril if they can't have the personal protective equipment. So the good news, if there's a bright spot, over the weekend, there was an announcement from the FDA that they've got a rapid new test that'll hopefully be coming out. How widespread the availability, they'll need a ramp up there. And you've seen more aggressive action by the National Guard in several states. We have the commercial labs are increasing capability to do more testing. There are studies coming out about treatments. Those still need a lot of scientific validation, however, but everybody is scrambling. It's a worldwide race right now.
And the FDA information that you just referenced, that's on something that'll be able to diagnose more and be available shortly? Okay.
Yes, and more rapidly, because the tests, the early testing actually took sometimes a few days to get results back. This, I understand, will be about 45 minutes. And the test that was announced will need to be run on the machines that the company makes. But I think I heard about 165 hospitals have that capability right now. So more to come on that one.
Yeah, that's still a small number though.
Right.
So all of us want to help support this. I think we're all, we've joined this conversation so that we can think about, what can we do? How can people help? Can you give us, our audience, information about how they fit into this and how they can provide some relief to deal with the critical needs that you just referenced?
Sure. And before I get that, just a mentioning about flattening the curve. So everyone on the call can take action in terms of the physical distancing. I know that's hard for everyone, but one of the slide that's up now shows a flattening of the curve. So at the peak of an epidemic that has not been put into check, we're already overwhelming our health systems, but you will do that even more so if we don't do the physical distancing. So that's really what that's about on this slide. So in terms of what philanthropy can do, if want to move to that question, there's a lot. Again, this is really a fluid situation, and the needs are changing day to day. So why emergency flexible funds are so critically important. One of the crucial needs right now, I mentioned our healthcare workers, being at risk, and protecting them with the personal protective equipment, N95 masks. There's been a shortage of surgical masks and just the worldwide supply chain. We are seeing that open up some, and certainly federal government is taking, I think, much more aggressive. We're seeing more aggressive moves coming there to get the PPE out to the hospitals. But I'll give you an example of what we're doing at the foundation, just to ground everyone, to give a real time.
Judy, just to clarify, personal protective equipment.
Yeah, PPE is personal protective equipment. So that's N95 masks, the gloves, the gear, the gowns and so forth. And so we received just last week, we received calls from partners on the ground that had been able to acquire actually large shipments of personal protective equipment coming in. There's been an increase in production, and we've got emergent calls where they said, we can get this out to our hospitals. Actually, one of our large states we did this with, but what they needed was to be able to have immediate payment and get this moving. We actually had one philanthropic partner that wanted to help their state, and we literally, my team moved that in an hour. As soon as we got the request, we had purchased that PPE, and that was going out to the hospital. Another call we got from one of the cities was that they had a donation of these products, but they didn't have money for transportation, and so they just needed immediately, and we turned that around at 30 minutes. We've got to move faster than the virus, and that's really hard to do. I mean, this is not a time to be slow. And then the other thing that we've been doing, testing, as I mentioned, has been kind of at a premium. On Friday, we quickly contracted to be able to cover certain costs required for the immediate deployment of COVID-19 testing, to increase that and to be able to have the testing infrastructure, again, in one of our large states that we were able to move quickly. So it's the speed and flexibility, trust, having a trusted network of professionals across the country that is the reason we move as quick as we do if we've got the funding.
Yeah, and how have you developed that trusted kind of structure and systems and controls that you put in place to be able to move money that quickly?
Well, so one thing, I mean, it helps. I worked at CDC for 6 years prior to this, and I was a state health officer in Indiana. So my own personal network runs pretty deep and has been, I've been in this for a long time. And so that helps because you know people. You know now who's the local health officer, and you've worked with them for years. So they always say you don't want to be introduced at the time of the crisis. You want to have those relationships prior to the emergency. So that's part of it. And then CDC, folks may not realize, but the Centers for Disease Control, 70% of their funding goes to state and local health departments. And so there's this incredible network that when they're doing their job and we're preventing, there's a lot of disease prevented. Folks need to know that there are always small epidemics that are being taken care of that you'll never hear about because they're preventing or getting in front of it. It's only when we have something like this and a virus that is so dangerous that all of a sudden all eyes are on public health, but they're at work all the time. So it's that ongoing network.
Good. So thank you. So you mentioned obviously we're thinking about this locally, we're thinking about it as a country, and we're thinking about it as global citizens. How is the CDC Foundation thinking about this, and what advice can you give to our donors who might want to respond in each of these categories?
Yeah, thanks for the question. So, and actually we're seeing donors that are saying they want to direct their gifts locally or in their communities or nationally or globally. And so the first thing I would say to everyone is right now, given the situation, Number one, the best gift is actually unrestricted, so that folks can move in real time, the professionals that are trying to manage this. The second would be geographic restriction. So if you want to restrict to a state or a particular city or community. And then the third would be a broad category, like communication or testing or research might be a way to think about it. So locally, the way we're seeing things, we're hearing from the local health departments. One of the big areas right now are homeless. There's huge need to help with the homeless communities, and that's an area because of close quarters they can spread easily. The local health departments are a bit of the tip of the spear, if you will, because they have the knowledge of their communities and where the epidemic is, where this virus is going. Just-in-time training of workforce at the local level. Universities are working with health departments now saying, can we change the spring semester to train our nurses to understand public health or think about all the other students? But that takes some funding. Some of that's not even large amounts of funding, but I had one request for $300,000 from a city that thought that they could turn around the spring training with that amount of funding. Supporting nonprofits that support public health. We just, in partnership with Kaiser Permanente, put $100,000 unrestricted gifts out to 11 nonprofit organizations that support some aspect of public health. And then, if we move to the national level, I will tell you the big thing's going to be telehealth. With the cases, we've got to ramp up telehealth quickly. Federal government is doing that, but there are still other needs on the ground to help really make that happen. And we're working with some communities now with that. Communication. That's a huge need right now at all levels, local and national and global. But this is affecting different populations differently. We know now that some of our young people can become quite seriously ill. We've got young adults that are not hearing the message. They're just not paying attention. We've got a lot of misinformation, and we have a lot of mischief in the system. People are deliberately trying to put out false information. That's dangerous. It's incredibly dangerous. And each community is different. So almost right down to the local level, being able to have some funds to do more communications. And then understanding clinical and epidemiological gaps, both domestically and internationally. There's some research needs, clinical research, because this is we're in a laboratory. It's kind of a global laboratory right now. We don't know enough. CDC has been asking us for help there. And then on the global level, there's great need for laboratory capacity, epidemiology, trainings, and just strengthening the international capacity. So there's a lot. It's a lot.
Yeah, thank you for all that. And I think that's very helpful to have some background information on what you're doing, and then also obviously individual organizations we should be thinking about in our communities, the country, and across the world. So, we often talk with our donors about the importance of funding long-term needs with the system while balancing the urgency of the moment. And this pandemic, I think, has really highlighted that those two things are working in synergy and are going to be necessary for kind of effective long-term responses. Do you have any guidance to help our donors respond to the immediate and urgent needs, but also prioritize long-lasting needs beyond the situation as it exists today?
Yeah, so the one thing we know is that this is going to be a long war. This is not going to be over soon. And so the risk that we're already seeing to social disruption and the social needs and the individual needs that we talked about, rebuilding small businesses, making sure our NGOs are staying in business because we're going to need them, health equity. I mean, there are a number of things. On a little bit broader level and on the public health level, my board that I report to at the CDC Foundation had a planning retreat in October, and we came out with priorities that we should be really working hard on at the foundation was health security and data modernization. Oh my goodness. This pandemic has brought home that we couldn't have higher priorities in terms of building systems. There's something called the Global Health Security Agenda that started just before Ebola. That's making sure that every place has the epidemiology capacity, laboratory, workforce, and emergency operations centers to be able to manage and detect. We want to detect these viruses and new pathogens, and there will be more new pathogens. We need to detect them early and try to contain them early on. Sometimes harder to do as this one has demonstrated. But so that's an area. And then nationally, I will say we really need data modernization. This is a huge area. I talked to some national leaders in epidemiology this weekend. If we had across our nation electronic case reporting where data is flowing from our hospital and clinical systems to our public health systems so that we can all be seeing what's happening much sooner and earlier and in real time, that's something our country, we should use this opportunity to think about the data revolution that should take place for public health, both in our nation and around the world. But it's one the U.S. can take on.
Oh, it's there's hopefully there'll be some silver lining at some point. We'll hope to celebrate, but right now it just seems incredibly overwhelming and wildly serious and dangerous, as you mentioned. Thank you so much for this update, and more importantly for your leadership and that of your team. Before I open up for questions and answers, I want to highlight opportunities to give in support of the medical needs. We have provided, Fidelity Charitable has provided a comprehensive guidance page on our website where you can view charities that have already been vetted by our team that are working incredibly hard to provide, immediate relief to the medical system. So I know we just wanted to share a couple of those with you as well. So we have some questions coming in. Again, as a reminder, feel free to ask questions through the Q&A box there, and we'll do our best to get to as many as we can today, but given the volume that are coming in, it's likely we'll kind of be providing responses after the webinar. So, maybe you've already answered this, but just what are some of the greatest misconceptions, misinformation that are out there that you could debunk once and for all, Judy?
Yeah, I think we started off saying that this was more like influenza and that, we have a lot of people dying from influenza each year. Influenza doesn't overwhelm our hospital systems and take all our supply chain. And so this is a serious virus. So that's one of the, I think folks have been slow to understand that in some circles. So that would be one. And then there are a number of, false things circulating around treatments and those types of things. Folks really need to listen to the scientists and the best science that's coming out around this.
Yeah. I think one of the things you said is that this can hit anybody at any age. And that's, I think, one thing that's important for people to recognize, that young people are just as susceptible as older people potentially can be. And so they need to be mindful in taking the precautions as well. Give me a positive story. Have anything positive that you can share about this pandemic that you're seeing in your day-to-day on the front line?
Well, I have seen this before in emergencies, and I will tell you it's inspiring to see people come together. It's inspiring to see the best of humanity rise in these types of situations. So we are seeing, I think, this support, and we need to do that. I would say that we didn't talk about the mental health aspects of this or the stress levels. Folks working on the front lines are really stressed. They're not getting much sleep. They need that support. But we're also seeing this groundswell of folks that are helping them, supporting them, encouraging them. It's kind of like the folks singing in Italy. That now is a time, I think, for all of humanity to come together and realize this is a common enemy. The other thing I would say on the bright side is innovation. We are kind of in this large laboratory, if you will, and people are innovating. People are coming up with things that will be a positive for the future, the current as well as longer term. So I think that on the other side, it'll be quite interesting to see what comes out of this.
So does anything come to mind, anything you've seen that's been innovative that you think will be a positive force post-COVID-19?
Well, on the innovation side, we're seeing a lot on the technology side. I think folks are racing. I mentioned telehealth. I think we're going to see the emergence or like the fast tracking of things that were in the pipeline, where telehealth can be much more right in the hands of everybody's iPhone, but having data that's more real time for the providers to see. I think we're going to see a movement to across our country of using that more. And quite frankly, that's actually a really great model with today's technology to be able to use that more, where you can have your doctor's visit, in the comfort of your home, and yet you can talk like you and I are. and so forth. So I think we're going to see that. I would say data systems, telehealth, and then I think this is going to push us with our communications. I think it's going to make us really stop and think about, we've got social media, which has an incredibly positive aspect, but we know that it can have a harmful impact. I think we've got a laboratory now for understanding that better.
One question here. What are we seeing with this situation that we have not seen before in responding to a crisis?
Well, never in our lifetime we've had pandemics. So let me go back 11 years ago. I was leading actually at a national level and at the state of Indiana, the response to H1N1. That was a pandemic. We were quite concerned. Turned out that virus was not as lethal as as it might have been. And so in our lifetime, no one has lived through a pandemic where it's happening everywhere, waves of this, and the disruption. We've never lived through anything to see this kind of social disruption. I was on a webinar with Ed Bastian and others from the Metro Atlanta Chamber recently, last Thursday, and to hear what this has done to when the airlines have to stop, when restaurants are closing, when the musicians can't have live performances. We didn't see all of that during H1N1. This is hugely different than anything any of us have seen.
Anything else you want to share with us that we haven't covered?
So I would just encourage everyone, when you have questions, because things are changing as the science changes. Another bright spot on this, our science has advanced. I mean, this was the fastest that we've ever had a novel virus to be able to know the genetic sequence and know more about it. So I don't want to. We've got amazing advancements. So that part is a positive. But I would say to everyone, first and foremost, take care of yourselves and take care of your families, and go to the CDC website to get the most up-to-date information that is coming out from the scientists, because we need everyone to stay healthy, as many folks. Then the second thing is think about this distancing. You can help recommend others to not run to the hospital if that's not necessary, making sure that we're doing things more remotely and calling to spare the hospital beds for those that really are in need. And then, my shout out for, again, I'll just reemphasize for those of you that want to help. I mean, just think about those points I made. We need all hands on deck. That's the bottom line. We really do need everybody on deck right now.
Just a question came through of what are you seeing in terms of availability of respirators? I mean, we've talked about masks and but once you have the virus, that has obviously been a concern. There's just not enough respirators.
Yeah, the respirators and ventilators. There's actually there is ramping up production. Folks are getting actually quite innovative. There's another area of innovation to try to build those. Right now, we definitely have shortages, but I think that's why you need all hands on deck. You need the innovators. You need those that can retool their factories to make these sorts of things. And we just need everybody engaged and everybody bringing whatever they possibly can to this pandemic response.
Do you think that people that are volunteering, I know here in my community, people are out helping pass out food and do things with the gloves and the masks, is that sufficient controls?
So I would just, again, the important thing is the physical distancing. So if folks are delivering packages, my recommendation is to leave them on the porch. And then, may not be a bad idea for the folks receiving the package to leave them in the sunshine for a couple hours or on the porch, or even 30 minutes. So we don't know enough about the virus and how long it stays on surfaces, but to be extra certain, it's just that distancing. But we obviously need people that are doing this sort of thing, right? I mean, we need our volunteers to help. So that's best advice, is that physical distancing, and you don't want crowded settings, those kinds of things.
But we're all going to pick up our meals, trying to support our local restaurants and things. They come out with the gloves and they hand you a bag. Should we be taking any precautions there as well?
So when they come out and hand the bag, again, short interaction. Don't sit in the parking lot and talk with them for a long time. So just keep that really brief if they hand it. Well, obviously we need to have food, and that's helping keep the restaurants in, keeping them in business if they're doing the carry out type of thing.
Well, thank you so much for all of the guidance and information. I think, while it's been wildly overwhelming, it's very succinct, and I think gives us all the sense of urgency that we need to have around this and making sure that we're doing what we're being advised to do in terms of the precautions to avoid spreading it. As I mentioned to all of you earlier, we'd like to emphasize again as we wrap up that, this has been a webinar that's been focused on how do we provide support for the medical relief, but we also want to be focused on vulnerable populations, protecting the elderly, protecting those that have endured, job loss. I know Congress is working rapidly to try to address some of the economic issues faced by this. We're going to continue to provide Fidelity Charitable guidance about those organizations. We actually have some organizations that are focused on the vulnerable, like the United Way. We also know that nonprofits are having challenges. I think, due to social distancing, critical fundraising events are being canceled. People can't use volunteers to help serve the missions. So I think it's important that people, regardless whether you're going to the event or not, get these organizations funding, continue to donate as if you were going to the events, because they desperately need that support. So I'd like to leave you with 3 key takeaways as we close this out. One is stay informed. Use the resources available to stay educated on how best to manage through this. We've never seen anything like this. We will get through it, and we're going to continue to make resources available about really wonderful organizations that are helping support this at both the community, national, and across the world. 2 is, I think as you heard from Judy, philanthropy is an accelerator. It enables speed and action. I think you heard, let's make sure that we're giving gifts that are unrestricted. I know a lot of the grants that are coming through Fidelity Charitable are indicating COVID-19. I think we want to continue to make sure that those dollars are being used as best determined by the nonprofit organization, but it's very critical that it go. And 3 is donate now. Don't feel overwhelmed. I mean, I know my personally feeling overwhelmed about where should I be giving, where is it going to make the biggest impact. I would encourage all of you to just start donating now, get money out of your donor advised fund to support this response, and don't wait. I'm inspired every day by some of the incredible stories that I'm hearing, people renting hospitals, people opening up their warehouses and things for medical purposes. It's just unbelievable what stories we have to share, and I know we'll have continued incredible moments that'll be in our local communities across the nation and around the world. So thank you, Judy, for your time and guidance, and to everybody at the CDC and the CDC Foundation for their important work. Thank you to all of you for joining our webinar today. Keep safe, stay home if you can, and hashtag give for COVID relief now. Thank you very much.
Thank you.